We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
Good morning. Today's topic regards malignant pleural mesothelioma epidemic in Mexico, as well advanced and challenges and diagnosis of MPM. You can see how Canada has poisoned our environment since the 60s. Now now it is turned out to be that Russia and Brazil are increasing their exports of asbestos to Mexico. The question is, we will stop these exports. Mexico has been one of the main importers of this carcinogenic fiber since the 60s. The USA asbestos industry has moved to developing countries, mainly to Mexico, with the consent of both governments, where you can see the chronology of the transfer of these hazardous companies. The next. Mexico has imported more than 500,000 tons of asbestos since 1960 to 2012. This is the tons. Taking into account our study, we have estimated an underreporting of 71% of MPM deaths. Based in this is official deaths. This is an underreporting. This is a lung cancer. Based in this, you will see the projection of deaths of MPM from 1979 and 2030. And there are 14,412 in both genders. And lung cancer, 2.2 cases per case of MPM. Contrary to what happened in other countries, Mexico doesn't have any kind of asbestos regulation. In Mexico, nor ban asbestos. Between 1980 and 2030, only 9 MPM cases recognized as occupational diseases. Mesothelioma is a lethal cancer strongly associated with asbestos exposure. Diagnosis remains as a challenge, and researchers are developing new tools for early diagnosis. In Mexico, the mean time for diagnosis of MPM is 11 months. Our proposal is to create a less invasive strategy for MPM diagnosis using ELISA and to present the performance of calretinin, mesothelin, and thrombomodulin. On this table, you can see the population description and our case control study. There are a significant difference among cases and controls for all biomarkers. In this graph, you can see The biomarker level, this is mesothelin for cases for control. This is calretinin for cases and control. The thrombomodulin is not good, the performance. In conclusion, there is a mesothelioma epidemic in Mexico with 500 cases per year. There is impunity for asbestos company from USA, Canada, mainly, but the Mexican government omission. Mexico must ban asbestos as an urgent measure to protect the lives of the future generations. Plasma-soluble mesothelin and calretinin have good performance to discriminate cases and control and may assist to diagnosis of MPM. We must develop public policies for epidemiological surveillance of MPM cases and for occupational and environmental compensation. Create a fund, pay asbestos company for this purpose, along with medical care, research, and environmental sanitation. Mexico, USA, and Canada must sign the Occupational Cancer Convention, C-139. For workers who contribute to the study and those who die for preventable deaths. Finally, but no less important, we are still missing 43 students from Ayotzinapa, Mexico. Thank you.